Good afternoon, everyone, and welcome. I know probably a few more people will be joining us. I think we've got a good number already in, so I'm going to launch. I want to acknowledge that when we scheduled today's conversation, we anticipated a more routine transition into a new school year than the one we're facing now, with COVID variants and daily emerging conditions. This is an emotional time when we need to pivot again, yet again. I'm here to remind you that you've got this. You know how to remain calm and make good decisions. Every day, your top priority is the safety of the children in your care. And by doing that, you empower their parents, their families to go to work. We are very fortunate to have Dr. Leah Costello from the American Academy of Pediatrics, also a pediatrician here at the Timberlane practice in South Burlington, Vermont. Dr. Brina Holmes will be joining us. She's with VCHIP, the Vermont Child Health Improvement Project, and the nurses from the Vermont Department of Health, Elisa Stolberg and Sally Kirshner. Welcome, Leah, Brina, Sally, and Elisa. Thank you for sharing your expertise and answering our questions today. We deeply appreciate these conversations. Our focus for this conversation is in support of you, Vermont's early childhood educators and business owners and operators and classroom teachers and directors. Use the information that you gather today and these resources to partner with your parents and families. Together with your parents, with your families, you can make the best decisions for you and for your program to keep everyone safe and allow families to continue to go to work. I'm going to hand it over to our co-presenters now, Dr. Leah Costello, Dr. Brina Holmes, Elisa Stolberg, and Sally Kirshner. Thank you.
Hi, I'm Leah Costello with Timberlane Pediatrics in South Burlington, Vermont. My role today is to help talk about the current landscape with Delta and other infections going on, talk about some return to childcare programs and help answer questions. I'm somewhat up to date on the state guidelines, but I'm going to let the Vermont Department of Health take those concerns and questions because that's not my field. But I hope that this can help provide a little clarity, and reassurance. There's still going to be situations where you need to reach out to your parents to talk about it more, or reach out to us as pediatricians to talk. That is exactly what we're here for, to just form a partnership with all of you to help keep these kids in school safely and allow parents to be at work and allow you to feel comfortable with your kids that are at the school. So I think that we have the first slide talks a little bit about Delta. The next slide. So I guess actually it probably just says this. So the current landscape is a little more challenging than we wanted. Obviously, when we finished out the public school year, the older kids' school year, we were really feeling quite good. And then as the summer progressed, I'm sure all of you started to see more and more colds, more RSV, more kids with croup, and then obviously more COVID. So it's been a wild ride this summer. And for those of us in pediatrics who typically schedule all of our checkups in the summer for school age kids, we were quite busy with those toddlers with snotty noses that we usually save time for in the winter and didn't save as much time for in our schedules this summer. So I think that as I've been presenting to schools and teachers, I've been kind of thinking about just how this is even different than last year. Not just Delta, but also just what we're seeing for kids and illnesses. But Delta now is here too. And what we do know about the Delta variant is that it does seem to be more transmissible. It is not 100% transmissible. That does not mean a child or an adult who comes into your child care center is going to give COVID to 100% of your classmates. It just means that a few more kids could, or adults could, but might not, with the right measures in place, likely not, catch it. But it does not, this is not a one-to-one, everybody gets it situation. And I just want to be clear about that, because I think that that's a little bit confusing. So, but we do know that it is a little more transmissible. And we do know that vaccinated people can get Delta, can get COVID, and they can transmit it, unfortunately. But again, with the right measures in place, we can really reduce that risk to your staff and to the kids and to the families. The other thing that we are seeing so far with the Delta variant, and we will, obviously, this is being watched very closely, not just by like our local pediatric groups, but nationally, it does not seem like kids get more sick from Delta. They might be a little more likely to get it, but they are not, it's not hospitalizing proportionally more children. I often talk about putting on my blinders and really trying to look just at Vermont. It's hard to read data coming out of areas where there's very few mitigation measures in place. So states where they just have very low vaccination rates, or a very high population of people who are not willing to wear masks. So I have to really put on my blinders and look at Vermont and our data. And while we are seeing children get COVID, and we have seen children get COVID all year long, we are seeing a little more of it right now. We are not seeing this uptick in very sick kids or hospitalizations. So the mitigation measures that we have put in place here in Vermont are still working and will still work. So that's some good news on Delta. The bad news was more that it just is more transmissible. So we are, and because we have this vulnerable population of kids that you and I all care for, that can't get the vaccine, we need to continue to have measures in place to keep them protected and safe, but also in childcare, because it's so important. Like, I have a 2-year-old and a 6-year-old and a 9-year-old, and my 2-year-old loves childcare. And she learns so much, and she does so much with them. So we all need this, not just for our kids, but for ourselves too. But the other piece that's a little bit more challenging about the current situation and the Delta variant is that we also are seeing a lot of other viruses. We're seeing RSV, we're seeing croup, we're seeing viruses that we don't typically see in the summer. I have yet to hear about any flu cases, but I don't know, it's coming. And so we don't typically see these in the summer, and it's just making it more challenging that the more kids are getting runny noses than they were last year. And we're having more kids out for daycare and needing to test. So what can we do, not just as a community, like encouraging our community, but ourselves in our office and in your workspace and in your childcare centers, is masking, mask. Vaccinate. Everybody who is eligible for the vaccine should be encouraged to get the vaccine, directed to their physician to talk about the vaccine if they have some hesitancy, and then staying home when sick. And so we've really pared down from the pages and pages and pages of regulations last year to those 3 key measures. We know now, 18 months into this, that we don't need plexiglass. We don't need kids leaving their stuffies at home. We don't need the significant cleaning measures that we needed, though that's not how we are spreading COVID. We need kids to wear their masks if they're 2 and up. We need parents and all eligible members of our community 12 and up to get the vaccine, and we need to stay home when we're sick and test. Sorry, I forgot that one. We need to test too. And luckily that is really available as well. And we're in a really good spot, I think, to handle this. We just have to engage our entire community to do these efforts for our kids. But so stay home when you're sick, get tested, wear your mask, and get your vaccine. So that I'm gonna, I think, hold up there and see where we're at with questions and concerns and what's next. But.
So Brenda, do you want to look through the questions that are coming in at this point, or?
No, Dr. Costello just answered a few of them. So I think if you just go, if we click to the next slide, we'll come to another natural place for some questions that weren't yet addressed.
Okay. So I can talk a little bit about this, and my colleagues, Elisa and Brina, you're welcome to pop in with more details. Just a little bit of a reminder that last June, the governor rescinded his executive order because of the data showing that more than 80% of eligible Vermonters received at least one dose of the vaccine. So this is when we talked with you all last June, we talked about kind of all these orders, and this huge, massive guidance was all off the table now. It wasn't necessary. And we also at the health department have learned about our legal authority. Now we went back to doing what we usually do and giving public health advice and relying on our clinicians such as Dr. Costello to give clinical advice. So that's where it has been through the summer. And you folks have been encouraged to do your own policies and procedures, how you think works best for your families and for your community. In general, the public was asked to do good hygiene, hand washing, be cautious about traveling, universal guidance, all those elements of the universal guidance. And then the summer came. You folks have been doing your procedures and policies over the summer. I'm not quite sure what some of them are, but we got a lot of questions. I think just to kind of reiterate that you're maybe not like what Dr. Costello was just saying, you're not doing as much rigorous cleaning or the fluffy toys and that sort of thing. There's no guidance on that. So that's where we were in June. People in the next slide, in just recently, Commissioner Brown from DCF sent out these basic points that Leah just summarized about stay home if you're sick. It's recommended that the child care programs require universal masking for all children and staff when indoors. And then I think a lot of us were familiar with the exceptions, like if it's a behavioral medical exception, to work with the medical home to see if that's appropriate for a certain child. And then the process, which is, I think, pretty similar as it has been with contact tracing. I'm thinking some of you would have been engaged with our health department contact tracers over this summer. The next slide. Just to remind, there's a lot of data on the health department, and it's broken out by age, so you can see that when you have all kinds of time to peruse the health department website. There is a question came in about the types of symptoms that we're seeing in children, and this is a breakdown of the symptoms that's on the site. The average illness duration is 5 days, and there's also information about the children who are eligible for vaccination, how many percentage-wise are vaccinated. So a lot of this information is on the website, and I didn't make a whole lot of data slides because I wanted to allow for more conversation.
Sally, can I jump in here for a minute?
Yes.
Is that, so COVID looks different for everybody. COVID looks like RSV, COVID looks like flu, yes. COVID looks like an extraordinarily mild illness. Our list is so long of symptoms. I would add like nausea, vomiting, diarrhea to this list too. I don't have any percentages for you. I don't even have like a kid cannot walk in and we can say, oh, this is COVID. Parents will say that. I don't think this is COVID. But we're like, oh, what does COVID look like then? Because we don't know as physicians either. So, really it just points to, like, you look at this list looks pretty long. And if we add nausea, vomiting, diarrhea, we just need to test. That's the thing that we need to do, is test. As soon as a kid is sick, just test. It's easy. The test results come back in honestly 24 to 36 hours. It's incredible. I just found out yesterday that any age can go to the health department testing sites, any age. It's remarkable, and it's easy. It's so easy to test your own child. And the results come back quickly. You can go if you have mild symptoms. I take that as like, you don't think your child's sick enough to need to see the doctor, but they're sick enough to need to stay out of daycare and get a test. And you can, they encourage you to make an appointment, but secret, you don't actually need to, you can walk in. I've been really promoting the Waterbury website too. It was drive-through. It was incredible. My 2-year-old just stayed in the car and I just stuck the thing in her nose and it was perfect. But it's easy. It's so much more accessible. And you can just, if a parent calls and said their kids is out, just get the test. You'll get the results back by the time they're well enough to go back to school anyways. So, and testing early in symptoms still catches COVID. We don't need to wait days to see that it's COVID. As you all know, as childcare providers, unfortunately, we are like most contagious, most infectious, like right at the beginning and sometimes even right before the illness. So if they wake up with a snotty nose, or a fever, you can just get tested. And you will catch it. If the symptoms are still going on in 3 to 5 days, maybe their pediatrician would repeat the test, maybe. But we're gonna catch it even if it's early, like really early in the course, so.
May I just pose one of the questions that we've had in a number of different iterations right now, and I'd love to hear from any or all of you. So I hear you, stay home when you're sick. We know that that's already, in the regs. It's good guidance. It's our best practice. We have forever and a day understood that runny noses happen with teething. So can we just talk about runny noses, symptoms for exclusion? I feel like there's a list of symptoms and we sort of skirted it, but can you just talk about symptoms for exclusion and when and how to come back, including, it sounds like test.
This is if you haven't really clear answer to this, you've really won the lottery, because it's not totally clear, and it is going to be kind of situation dependent. But we all know that kids after a cold can have runny noses for weeks and weeks, and we clearly cannot keep them out for the entire course of their runny nose. We also know that kids have runny noses when they teeth. They have runny noses because they don't know how to clear their nose. They don't know how to blow it, they just let it run. So yes, there are reasons that kids can have runny noses. And we can't keep kids out for every single runny nose. When I counsel parents on this, in the same way I would counsel you, is that if there is a very sudden change in it, it is like you wake up one morning and it's crusted across their face and you're like, shoot, that's new, that's different. The same with you guys. If you have to wipe their nose suddenly 5 times in the first hour that they're there at childcare, that's probably new and different. We can test, stay home, test. They can likely even return to childcare within a couple of days if symptoms are markedly improved. So they can't come back, even if they're negative, they can't come back if their nose is running and you're wiping it 5 times an hour. But if it's improved and they're kind of a little bit of a drippy nose, they're negative, the kid is eating well, playing well, acting well, I think we really need to look at how they're acting too. To say, is this a kid who's running around the woods, climbing up every slide, eating their entire lunch, but they have a runny nose? That's probably either related to teething or it's related to just that 4 to 6 weeks of a runny nose after a cold. So new symptoms or a sudden worsening, like they have this kind of constant drippy nose, you wipe, before lunch, after their nap, but then you're suddenly wiping it multiple times. That would be a new and different thing that we test. We make sure that it's starting to diminish, and bring them back into daycare. I think teething is another hard thing. I've spoken with a couple of daycare programs just about kids pool their drool when they teeth sometimes. Actually, just in general, they kind of just hold on to their secretions and they're drooling, they're snotty, they're kids. And then during a nap, they'll cough a little more because it's just kind of all sitting in the back of their throat. The kid who is acting well all day, ate their lunch well, or ate their lunch the way they normally eat their lunch, coughs during nap time, gets up, stops coughing, healthy, no fever, nothing else going on other than this cough that came up during nap time. That might actually be just that they just had more drool and it's just causing some cough when they're laying down. And those are really hard things to like cipher out. So call the parents like, hey, how are they acting at home? What's going on? Does this happen? You know, do they wake up kind of in the morning this way? Do you hear the occasional cough overnight and they get better, or is it getting worse? Is this new? I know it feels hard sometimes, and it's felt really hard the last 18 months to trust the parents. But the more trust that you have in them, the more trust they have, or at least my kind of experience. If I really like, trust in what they're saying, they trust in what I'm saying back too. And it's a much more mutual, relationship that gets us moving forward to help do what's best for the kid and the family and the community. But that's not a perfect answer, and there is no perfect answer on this. So sometimes you just have to follow your gut too, and send them to get tested.
I really appreciate your point to just be in open communication and really, work at that relationship with the parents. And sometimes, that is like the conversation about, hey, have you talked with your pediatrician yet? And just noting all the things that you've observed. Thank you.
I think that's also, another point from being a pediatrician, and you guys too, we can only trust what the parents are telling us. We see the kid for 10 minutes, maybe 15 if we're lucky. It's a really short window that I'm seeing a patient in. They could look amazing or they could look really sick. But I have to trust in what the parent tells me. And if they say, at home, they're not doing any of these things, at childcare, they are, that that puts us all in this funny position. And again, I just have to trust in the parents. And that's probably when you are getting, I don't tend to write a lot of notes for daycare. I hope I don't. But that's probably where you're getting some let this kid back into childcare notes, is the parents reporting nothing's going on at home. This is only happening at childcare. And that's, that is probably a situation where just running around or crying, if a kid really kind of cried at drop off, they might have a runny nose for a few hours. That being outdoors, the kind of mild allergy type symptoms that, but if they're really acting so well at home, that's a situation to really work with your families and say, okay, this sounds like there could be just something going on here that we need to talk about and think about together.
Hey, Brenda. Hi, everyone. I see so many familiar names on this. It's nice to see you all. I wanted to just add my gratitude for all that's transpired and all that's ahead. A few things. So the health department is up. We're updating. I'm not there anymore, but we're helping the document for you about return to childcare after illness. Some of you have been asking in the questions about, if the test is negative, do you get to come back even if symptoms persist? That's all going to be addressed in that link that you're already, I'm sure, very familiar with using. It's going to be updated to reflect this shift that Leah, Dr. Costello described beautifully. Last year, we were really putting symptoms together in pairings and wondering about higher risk for COVID in a certain constellation of pediatric illness symptoms. And that's all really different this fall. We're now seeing that any symptom that persists more than a day needs a test, and on that long list. And Leah's right, it's longer than this is the list of data, but the list is on this handout about nausea, vomiting, etc. So that's a big paradigm shift, that we're not going to sort of qualify the illness symptom with severity or combination. We're just seeking duration. So if it lasts more than a day, off you go for the test. And we actually are also encouraging people to get tested sooner than a day if several circumstances exist. You just want to get the answer. You know, it's just a fever, and you figure it out today rather than wait till tomorrow. So there's going to be some help for you in that arena, because I know last year that was in some ways easier. And then I also wanted to note for everyone that we feel like everything we do is a work in progress because of this team-based care that Dr. Costello is describing, that you've got these teams of families, yourself and your medical professionals trying to figure out how to proceed. And some of you have put in the chat that there are providers, healthcare professionals in your community just not doing this. And that's a really important, you know, we're doing a lot of good communication with our healthcare professionals, but not everyone is picking up on handouts and thinking that every runny nose should head toward a COVID test. So we just want to keep in direct communication with you about pockets of communities in Vermont that need more education about where we find ourselves with children, and just feel like there's open door between the Health Department, the American Academy of Pediatrics, and you all to bumble through, because these next few weeks in particular are going to be, and you've already been doing it all summer. We're just trying to put a little more structure around it for you, because I know you've been struggling with illness symptoms in your children all summer. So I'll stop there.
Brenda, there's a lot of questions coming in. Do you want me just to do the last few slides and then go back to the?
Yes, I think go ahead with, go ahead with the slides, and I'm sort of trying to organize the questions. So,
yeah, okay. Yeah. So then the latest I've been hearing, and Leah and Brina are welcome to weigh in, that it'd be like by this winter that they're going to be maybe thinking about approval for children under 12 years of age for a vaccine. And again, we've talked about this, that this is eventually going to look like, we're hoping to get to a point that this is going to be ongoing, like with our other required vaccines that have, for these other diseases that we don't know too much about these days, because we have good vaccines for them. So hopefully in the future, this will look like just regular vaccines along with flu and better systems for families to access the vaccines through their medical home. We had last spring, AAP put out several family community virtual forums for families to talk about vaccines and ask questions. And of course, it was around adolescents because it's 12 and older. But those are still on the AAP site. They're very good. And if it would be helpful for your community to have a pediatrician come and present again, please remember that and reach out to Dr. Costello and the AAP. Next slide. So this is what we've been talking about, with that it's a little extra confusing because we don't have the formal guidance. But as Brina described, we are still getting informational pieces on our website that you folks can use, and in determining your own procedures, which I'm assuming you've done a lot over the summer already. A few days ago, Commissioner Brown put out his memo about that we're asking childcare programs to require universal masking. And again, we can't require the programs to do that, but this would be a good practice to do. So this would be universal masking when indoors. And also, as you've been doing all summer with any kind of COVID-related ongoing policies and practices that, of course, are in compliance with CDC regs and are congruent with what it says in the Caring for Our Children. And I think you folks are pretty experienced in negotiating the regs and Caring for Our Children and your own, the policies for your own business. And also we have, in the spring, we contracted with AM Trace, and these folks are all trained up and working with us now. I just heard the other day, they're now called AM, and they are part of our Vermont Department of Health workplace. And you may talk with them as if there's a child who's been exposed or is a case in your program. And a lot of the information is also on, again, oh, wait, next slide. So here's a few of the links that I think a lot of you are familiar with. As Brina said, we're finalizing information for families about return to childcare after illness, and we're also working on for school-age children. And all this information is on these sites, and it will be updated. Updates were coming in this morning. So to check out our website, here is the phone call. I see in one here, there's a question that it used to be a special option when you call that 863-7240 number, and it's not there now. I think it's, you press number 8 for general questions. So just call in and hear the different options, and number 8 comes up. So that's where the people are who are able to help you if you think you have a case. If you have questions about this and that, just give that number a call. And we're working with those folks here at the health department too, as our MCH team. If you go through, the next slide is back to questions. And then also the final slide is just, again, we thank you folks so much for doing this. As Brina noted, and Dr. Costello and Brenda, you guys have stayed open through all of this and have been so key in allowing families to go to work, and also to continuing children and their learning experiences. So it's so important what you do. So that's about what I had planned to say, and we'll let go back to some of these questions that are coming in.
Mm-hmm. Sally, I should probably, oh, getting an echo, jump in. You know, I forget sometimes, I do a lot with elementary schools, well, and like the school age kids. We talk about masks, and I think I'm really redirecting my conversation to talk to early childhood educators. At the American Academy of Pediatrics, the CDC, we really strongly recommend masks for indoors for children 2 and up. We know masking works. We know that it helps reduce that risk of transmission between kids and from childcare providers to kids or vice versa. That masking 2 and above when indoors is our recommendation, our firm recommendation. That being said, I have a 2.5-year-old. I know it's challenging. Just like you guys are helping parents with behavioral concerns, you're helping us with toilet training, you're helping us establish routines around naps and eating and all those things that you help teach kids that then can be used at home too. Practicing masking, spend a lot of time outside right now. But practicing masking while indoors, we never want it to be punitive. Like, I would not make a child upset over their mask, just reward the positives and try again in a few minutes. But I know my 2.5-year-old whips it off. She talks a big game. She wants to be exactly like her brother and sister. But the second we walk into the grocery store, it's off her face, and we just like kind of wait a minute, clap a little bit about our mask and try putting it on again. That is really challenging when you're taking care of multiple kids, we know, but trying it, modeling that good behavior, modeling that masking, and asking the parents to do the same when because we have to take our kids to we have to take our kids to the grocery store, we have to take our kids places, that if we all are in this together, kids can easily accept masks. And I have a lot of, even before 2, some kids will be in my office at like 18 months wearing a mask. It's remarkable. Mm-hmm. They really, some kids pull it off immediately, and some kids do really, really well, but don't discount just that effort of trying and kind of praising it and making it a positive thing, because it might not be going away anytime soon. So that we probably should start doing all 2 and up and just start practicing and having times where we do that.
You've answered a lot of the questions about masks. There are a couple of others. Some folks are wondering, so there's not a mandate right now to wear masks, but what I hear you saying is mask, 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 and definitely indoors, and kids 2 and up, or human beings 2 years of age and up. If you've got 18-month-olds who want to do it, sweet, have them mask. One question came up about outdoors. What are your thoughts about outdoors? And then another one, I'll just say the questions and you can answer both of them. And anyone is welcome to jump in. The other one is like, how do you tell families what is a mask, what masks qualify? Someone had mentioned that they had a family who was sending kids with mesh masks. And I'm sort of like, is that really a mask?
Not a thing.
That's a mesh on your mouth. That's not, so yeah, your thoughts on these things.
You do not need to mask outside. So spend out as much time as possible outside. You do not need to mask clearly when you're eating or napping. And I know those kids are going to be closer together during those times. The distancing stuff has really kind of moved to the back burner as well. We distance if possible, but it's not this like very strict, so many feet between children, just distance if possible at times when they don't have their mask on. But so even though we have those periods of the day where we're unmasked, when we're indoors and playing together, masking can help just further reduce that risk. So we can kind of have multiple layers in place, including spending as much time out as possible, and then all the things the vaccines and the testing and the staying home when sick, and then masks when we're indoors together and not asleep and not eating, or practicing masking at those times. An acceptable mask covers, the nose, the chin, fits comfortably. That's the most important thing around a mask. It does not need to be a KN95, or it does not need to have a nose wire. It just needs to fit the child comfortably, covering their nose and their chin. It should not be mesh. That's ridiculous. I don't even know what to say about that one. So
one thing that I would just add to that is really, as the program operator, as the director, as the person who's interfacing with families, I have spent many, many years in classrooms. We have the regulations, we have that guidance, and we have caring for our children. Also, we have that guidance. And we still get to be the ones who make the decisions about our program. So we follow all the regs, and then we can say, yeah, it can't be a mesh mask. Like, you can say that. You've got that authority. So exercise your program owner, operator, director authority in a way that makes families feel like they've been a part of the conversation. Like, oh yeah, that's not going to keep any germs. Use your best educator approach.
Yeah, and Brenda, let me just put some more language around that for where we find ourselves. So this word required, recommended, should require, like, we've shifted to pediatric medical advice. So when you as a program are thinking about how you want to set up the fall, or maybe you're already thinking about it this second, what are your local and state pediatrician leaders telling you, and how does that help you set your own plan for your families? Because I think the word require, at least from all my years of working with you all, it brings up this feeling of the regulatory piece of your licensure, and that it's a requirement. It is not a requirement. It's worded very carefully that you should require, which really is just language. But that's why we did today, is to bring forth pediatric leaders to say, this is going to be your best mitigation strategy, and take it out of the regulatory place.
The school nurse coordinator I work with closely here in the Champlain Valley School District asked me the same, like, what do we say? She wanted some articles and stuff for parents. And I said, there's articles everywhere. Just a firm statement that, like, our program is following the recommendations of the American Academy of Pediatrics, the Vermont chapter of the American Academy of Pediatrics, and the CDC, and we stand behind those organizations and their recommendations. And be kind of like, you can say, like, oh man, I understand it's really hard, but just a firm final statement, this is where we stand.
Thank you for being so clear on that. When I said at the beginning that I hope that that folks can take away the resources and information here. So I consider the American Academy of Pediatrics and the Vermont chapter to be a huge resource, as well as the Vermont Department of Health. So thank you for being explicit about that. We have a series of questions also about testing. Folks are just curious about the dynamics of like, what if the pediatrician of a family is not encouraging testing? Sort of, can you what do you tell folks when they say, help, should we have kids tested? How do we navigate that conversation with families?
That's a tough one. And I'm not, I'm most familiar with the pediatricians up here in Chittenden County, and I think really so many of them are on these VCHIP calls. I see it every day. I would send them the document that Brina is going to share soon once it's finally edited, about return to childcare that they could share with their pediatrician. I would, now that you know how easy testing is, and how readily accessible it is, and that you don't need your doc to do it, that you can share that knowledge with your family. It's like, hey, you know what? We would all just feel better if we just did a test. It comes back really quickly. You just self-swab your kids. It's really easy. It's like just the front of the nose. You don't have to stick anything into their brain. We promise. We don't make parents do that. But you can help kind of facilitate that like, this is the recommendation from the Vermont chapter of the American Academy of Pediatrics, the Vermont Department of Health. It's easy for you to do. I'm really sorry that's not what your physician asked for. Maybe connect with us. I spoke with probably somebody on this phone call today regarding some RSV testing recently. That was more just a miscommunication between the family and or misunderstanding from the family. But I just called the daycare and I said, what's going on with this one? But you can feel free to call the other way, call us and just check in and say, am I giving them the wrong information? How can we help this family? But
thank you. And some of the other panelists have also dropped in articles and issues. More resources in the chat. So open the chat and just click on those links now. They will also be posted when we put this on Let's Grow Kids website resource page, but you can have the page open and check it out after this is over. And those are great resources to share with families. Coming from the American Academy of Pediatrics and the Vermont chapter.
I saw briefly that Becca Bell put in her thing on Medium.
Yeah.
That was fantastic.
Yes.
It was very well done, very clear, and I shared it with many, many parents, and they really enjoy it.
Yes. So we've got the AAP as an authority. Woot, woot. I see also someone asked the question or posed that they've been getting offers from services who say, hey, we'll come into your program and do routine testing in your program. Is that a thing? And like, what's, is it a reliable thing? Like, how do you know if that's a good feature?
That's you, Brina. Take it away. I have no idea.
Yeah, I think I saw that question from my old friend, Andrea. Hi, Andrea. They're like all good experiences in the United States. There's a capitalism component to this, and I would be very leery of offers of that you have to put up some cash to get some sort of surveillance testing in your center or in your home, because but there certainly, that is how colleges roll. They have contracts with testing centers and have produced a fair amount of budget and resource in that direction. But knowing what your budgets are like, I would recommend you stick with the ready availability of on-demand testing in your community. And we should say that this whole approach to illness hinges on ready availability of on-site testing in your community. So Elisa is on with us, MCH director. If that's not true, or if you have glitches, that's a great role for the MCH division, right? We really don't want to keep promising something that turns out to actually be problematic. And that's true of test turnaround time as well. So Leah described this utopia of 24 or 36-hour turnaround, which is many people's experience. We also have other people's experience that they don't hear for several days, which between us often turns out to be a glitch. So don't sit tight thinking 5 days is routine, because that often is something wrong with the process. So this is this kind of quality improvement that we're continuing to need connectivity with you all to make sure we're setting up the system and that it actually works.
We tell parents 2 days. It's just our experience this last couple of months has been really fast. Very quick turnaround. Oh, Lisa, can you comment on the testing at the testing sites? Is it for all ages now that parents can go in and self-swab their children?
Yes, we just updated the order so that any VDH or health department site allows for an individual of any age, which includes infants. And the new COVID resource centers that will be available, some already are, but they'll be available both for testing and for vaccine. Also do have no parameters around age in terms of their relationship with the health department. So presumably any of those sites you can go to, you can bring a child of any age. And if you are experiencing something different than that, please get in touch with us and we'll investigate and try and fix that.
Thank you. I see that Wendy would like to address the question about contact tracers. There's been some buzz that maybe there aren't enough contact tracers, that contact tracing is behind. And so, Wendy, are you available to answer that? Maybe not. Okie dokie.
Brenda, I can speak to it.
Thank you.
So the health department is working, I think it's fair to say that the cases rose faster than the available contact tracing staff. So a number of, Sally spoke to the contract that we have with AM Trace. They are staffing up and actively training new contact tracers. And we at the health department have redeployed a number of our contact tracing staff to do this work in a very quick manner. So hopefully that will all come together really quickly. You will expect probably next week a memo from the Child Development Division and the health department around the contact tracing process. We are, for those of you who are operating over the summer and may have had a case over the summer, may have had an experience different than last spring and last fall, but we are returning back to our process whereby we're gonna, the health department will ask childcare, out of school time programs, as well as schools, to do the primary contact tracing within their center or facility, and develop a line list and work to identify close contacts in partnership with the health department. So you'll continue to meet with them. And hopefully, depending on what happens with cases, we hope to be able to offer programs in the near future the opportunity to choose that role as doing internal contact tracing or having the health department do that. And we'll provide more communication, and there are pros and cons to both strategies, and we will work with you throughout that process.
Thank you, Elisa. I'm sorry, Wendy, to put you on the spot. I just saw you had made note in there. So there's a whole series of, and like sort of wide range of questions about the vaccinations for young children. And there's, like, there are questions that get at, will it be required? And I believe I heard you say, Dr. Costello, that there's the possibility that it could just sort of join all the things like, mumps, measles, rubella, chickenpox, all that. But if you could just speak to, what is anticipated at this time. And also, I believe you said that there's a hope for within the next 6 months or 6 to 9 months, a vaccine for children under 12. And, what's realistic? Will it be required? How do we roll that out with families, et cetera?
I don't have any secret information. I think my patients think I do too. I'm really just as up to date as anybody else who can read the news. It's not maybe late fall. I kind of joke with my families that they keep saying like late fall, early winter. So is that like a Vermont fall, like tomorrow, or is that like a Florida fall? I don't know. I don't know when it's coming. Hopefully in the next 6 months. It sounds like it's probably going to be elementary school age first, and then the younger kids. They're working on different dosing for those ages. We are really at the whim of the FDA. The National American Academy of Pediatrics is sent a very strongly worded note about the importance of the vaccine, and that, but until we have the vaccine, all the things that we've talked about, I have no idea about requirements. We do not require flu vaccine. Would I love to have flu vaccine be required for school and daycare? Yes, but that's not required. We don't, we do have vaccines that are not mandatory. So I think that would need to come from a state level. And then I don't know about requiring vaccines for adults, but I can say that this is a community effort. And if any of you on here are not vaccinated yet, please, please consider getting the vaccine. It is so important, not just for your health, but for the health of everybody in the community. And that's like, we need to really think about our community, not just ourselves right now.
Brenda, this is Elisa again. I can thank you for saying that, Leah. I can add a little bit more context. Again, at the health department, we don't have any secret information either. However, we are planning for the vaccine rollout so that when it is authorized, we can sort of be at the ready and get going. And so the health department has right now a draft operational plan, which is a combination of vaccine sites that are in pediatric primary care, many that are school-based, and then sort of the last third that will be community-based. It's not likely that there will be vaccine clinics in childcare settings because of some of the regulatory issues. However, there will be ones in the community, and right now we believe that the parent-child centers will be in most communities vaccine sites. So we're kind of working that all through. We're preparing all of the messaging to families and materials that you will be able to hand to families when that minute we hear that there's authorization to give vaccines. So more to come. We'll keep you posted as we learn it, but definitely in as much preparatory mode as we can be right now.
Thank you. So there are a couple of questions that get at practices that we had put in place during the when there was an executive order that we were in a state of emergency. And those are things that involve like other folks being welcome into our programs, families doing inside drop off, things like screenings. Now the regulations say that we, sort of do the daily screening as, always sort of just the visual and making sure that the child is okay, but we've set up special screening processes and and things like that. So can you speak to those concerns that folks have raised? And I'm fine with whomever wants to address that.
I can just really quickly, I would defer to the clinicians on the call to sort of answer questions about whether or not we recommend them. But I think you shared this, Brenda, that there isn't guidance that requires any of that to happen right now.
And I would
this
say
falls
that's
back on what Brenda said. Oh, go ahead, Leah.
Oh, I was going to say it falls back on the parents too, that we ask the parents to screen the kids. I mean, we're asking that in our office too. Like, if you have a sick visit, if you have a checkup scheduled and you're sick, please give us a call and we can make the necessary accommodations. But you guys to putting that back to the parents to screen kids prior to coming in.
And with regard to visitors and where parents do their dropping off, and that's back to what Brenda's point earlier. These are your environments, and there are pros and cons on all sides. I certainly heard all year about the impact on families and children with drop off being, timed and sometimes had to be outside and all of that. I think that at this point, what works best for families. I did hear from some providers it was a lot simpler to not have lots of parents in the building for several minutes, hours, for drop-off reasons, of course, allowing for situational anxiety and transitions. And then also the visitor volunteer piece, as Elisa said, is all back to your, beliefs on the needs of your program, but also putting some health parameters in place, making sure you know who's coming, that you can reliably assess. They are assessing their own health status that day. And, I would go further to say I would prefer volunteers and visitors be vaccinated, but that's not something you probably have any ability to do. So I'm happy to talk individually with folks about it. I do think each community has to have decision-making conversations about where we are in the pandemic and how you want to proceed this fall. Hard decisions.
Yes, we have just a little under 3 minutes left, and we've tackled sort of some big groups of that touch on a lot of the questions, but there are still some that haven't been answered. And if you have submitted a question that wasn't answered, we are going to we always collate the questions after this ends. We send them out to all the panelists who are present, and we ask for their input, and then we post that along with the recording of this conversation on Let's Grow Kids COVID-19 resource page. So there are a number of questions about can testing be required for kids to return? Can testing be required for staff, et cetera? What about exposures? And so we'll answer those with the best information that the Department of Health and the American Academy of Pediatrics has available to them, and we will post those along with this. Dr. Bell has just made note in the chat, and I'll just share it. Just want to see that, Dr. Bell.
Yeah, I hear a lot of these questions, and a lot of them are going to be answered by the algorithm. And I think that the piece around testing, as mentioned already, we are in a different testing environment, and when in the past, over the last year, when clinicians were thinking about testing kids, that was in a different, what we call pretest probability situation, where we had like really low rates of COVID. And so it may not have been recommended in the past, but for now, because we have higher rates of COVID, basically all pathways lead to testing, which is, you'll see on our updated algorithm. And so it'll become a little bit more clear. And I apologize that we didn't have it done. We're like making sure everyone looks at it first, so we don't have to edit it a lot, but it's like nearly done. And I think a lot of those questions will be answered. And certainly you can sort of use us as cover, with families and saying this, this is what's recommended. Because I know it's hard to make it when parents feel like you're the one making the decision, but having a nice, pretty straightforward algorithm can be helpful.
Yeah,
So,
Rebecca, just to clarify though, the algorithm's not for childcare providers. I think you're welcome to look at it, but what we've tried to do, and Nate at the health department and Caitlin, our school nurse consultant, are translating it into a parent and childcare provider document, because the algorithm's really a clinical decision-making tool that is communication between nurses and doctors. So I just want to be clear, the word algorithm, I know what you mean, but it is an important distinction, because if the algorithm is available to folks, I just think it's very detailed as it relates to healthcare. So I don't want you to ever feel that you're in that position as a provider. I think you need teams and the support of your local pediatric medical community, which we really are here to solidify.
which we thank you greatly for. We have come to 2 o'clock. Thank you, Sally and Elisa, Leah and Brina and Dr. Bell, and anyone else who contributed today. Just really appreciate your time, your expertise, your insights. And again, to those of, I know many of you have to leave and go greet the children who are waking from their afternoon rest time and carry on with the rest of your day with kids and staff. So thank you for making the time. This will all be available to you on the Let's Grow Kids information site. And Kathy, if you could just pop up the last slide for anyone who's still here. I also want to just make a plug for signing on to Vermont Child Care Links, which is a great resource for programs and for families in finding each other. There was one other thing I was going to say and it escaped me. So I'll just say goodbye. Have a great afternoon. Stay cool out there. Again, thanks all.